Hi, my name's Jessica Navarro, and I chose poverty as my topic. One of the key policies that affects poverty right now is the One Big Beautiful Bill Act, or OBBBA. It makes some of the biggest changes we've seen in years to public assistance programs. At the heart of it are deep funding cuts and new rules that make it harder for people to qualify or stay enrolled in these assistance programs. For Medicaid, the law trims hundreds of billions of dollars over the next decade and adds stricter requirements. Adults between the ages of 19 and 64 now have to prove they're working or in approved activities to keep coverage, and states will have to recheck eligibility more often. Some groups, including certain legal immigrants, will lose access altogether. States also lose some of the financial tools they use to stretch federal dollars, which means hospitals and clinics that depend on Medicaid payments, especially in rural areas, could struggle. It also affects SNAP, the Food Assistance Program. The law limits how much benefits can grow with rising food costs, shifts more of the administrative costs onto states, and raises penalties for errors. Work requirements are tightened, and entire programs like the nutrition education program are eliminated. All of these changes mean fewer people will get the help they need. More people will face red tape challenges, and states will carry heavier financial and administrative burdens. Critics warn that this could leave millions without adequate food or health coverage, with older adults and low-income families being hit the hardest. I chose OBBBA as my current policy issue, which is repercussions for those currently in poverty and experiencing homelessness, and the shift we may see of vulnerable people expected to fall into this category. With OBBBA's cut to financial assistance programs, it affects programs that millions of people rely on every day in order to meet their basic needs. These cuts are likely to increase homelessness, healthcare costs, the national debt, which is going to impact the whole nation. I am passionate about the homeless and unhoused populations. These populations often experience social injustice and discrimination based on their economic value alone. People experiencing homelessness face more than just the loss of housing. They're often stigmatized with negative stereotypes and excluded from services that require them to have an address or an ID, and criminalized for basic survival activities like sleeping in public. On top of this, many face discrimination from landlords or employers, along with limited access to health care. These barriers deepen inequality and make it much harder for unhoused individuals to regain stability and dignity. OBBBA is only going to make this worse. OBBA personally impacts each of us. If our families were to ever need help with health care, housing, food assistance, income support, it's going to affect us. My daughter is currently 7 years old and has disabilities, including cognitive challenges, which will likely limit her ability to work full-time as an adult. She will most likely depend on a fixed income and public assistance programs such as Medicaid and SNAP to meet her basic needs. The OBBBA is especially concerning for people like her because it cuts funding for these essential supports and adds stricter eligibility rules and work requirements. For some with cognitive disabilities, meeting those work requirements might be impossible, putting her at risk of losing those critical assistance. These changes could threaten her ability to live independently. So for families like mine, OBBBA isn't just a policy, it directly affects our loved ones. to financial assistance programs under the OBBBA came from several factors. The administration argued that reducing government spending was necessary to lower the national deficit and viewed these safety net programs as an area where costs could be trimmed. Lower federal revenue after the 2017 tax reform made funding these programs more difficult. Lawmakers also believed that reducing reliance on government aid would encourage people to work and support themselves, arguing that some of the programs were poorly managed, too expensive, or provided benefits to people who were not making efforts to help themselves. The OBBBA is a significant policy issue because it makes major changes to financial assistance programs, taxes, and benefits that affect millions of Americans. It matters because it directly impacts vulnerable groups who rely on government support, including children, our aging population, low-income families, and the homeless. It is going to directly affect people's ability to meet basic needs and widen that social and economic inequalities. 3 areas that are affected in the OBBBA include Medicaid, SNAP, and student loans. For Medicaid, it imposes stricter work requirements, higher copays, and more frequent eligibility checks. Additionally, it reduces federal funding to non-abortion related services such as like cancer treatments, contraceptive care, leading to some providers discontinuing Medicaid acceptance in general. For SNAP, OBBBA shifts a portion of SNAP costs to states, which may lead to reduced benefits and eligibility. Starting in 2028, states will be required to match a percentage of SNAP cost, with higher error rates leading to greater state contributions. And for student loans, OBBBA caps the amount of federal loans that students can borrow for graduate school and professional programs. This is negatively impacting high-cost education, such as like medical and dental schools. So it's going to change, this change will reduce the number of medical professionals able to complete their education. Let's take a look at how this news article and this policy issue affect or connect to our course content. So poverty in the U.S. reflects both systemic inequality and individual circumstances. So in our Karger and Stoss textbooks, the progressive view on poverty is that the elite individuals take advantage of the poor while protecting their own interests. While David Gill says that poverty can be looked at in terms of someone's standing in society, the way resources are distributed, and how work is divided among people. In 2018, 17.2 million people lived on less than half the poverty threshold, including 5 million children under the age of 18 and 2 million seniors over the age of 65. By 2019, 34 million people, 10.5% of the population, were in poverty. In 2023, 22.6 million households could not afford rent, and about 1/3 of the adults over 65 were at risk of homelessness due to high housing and utility costs. So the OBBBA compounds these challenges by cutting funding for our public assistance programs, imposing, like I said, stricter eligibility rules, adding work requirements. These reductions disproportionately affect vulnerable populations, such as, seniors, children, people with disabilities, making it harder to access supports to meet their basic needs. The cuts could push households deeper into poverty and increase the risk of homelessness, worsening the very inequalities highlighted by poverty research in our textbook. The Byline Times article, "Trump's Big Beautiful Bill Act is a Ticking Time Bomb for Elder Homelessness," highlights the growing financial pressures facing older Americans and the potential consequences of the OBBBA legislation. In 2019, the poverty rate was 9.4% for adults aged 18 to 64 and 8.9% for those 65 and older. Over the past 2 decades, the number of seniors spending more than half of their income on housing has more than doubled, rising from 5.2 million to nearly 11.7 million, creating significant strain on household budgets. Against this background, housing advocates argue that the passage of OBBA, a 900-plus page mega tax and spending law that includes historically large cuts to social safety net programs critical to millions of seniors, constitutes a ticking time bomb for elder homelessness and will exacerbate destitution. Cuts to federal funding assistance programs are expected to further strain low-income older adults, increase homelessness, and put additional pressure on already stretched housing and support. Passage of OBBBA, with its historically high cuts to social safety net programs, directly worsens issues highlighted in the Social Work Speaks book. The NASW emphasizes that homelessness in the U.S. has reached a critical inflection point and persists as a reflection of ongoing poverty, lack of affordable housing, insufficient resources. By reducing access to federally funded assistance and affordable housing support, OBBBA increases financial strain on vulnerable populations, forcing difficult trade-offs in essentials such as food, healthcare, transportation, retirement. Moreover, the law may worsen homelessness by eliminating job opportunities and public assistance, compounding behavioral health issues, domestic violence challenges, all of which are key policy concerns identified by social workers. In this context, OBBBA represents a policy development that contradicts the profession's goal of promoting economic and social well-being for older adults and other at-risk populations. In our American Social Welfare Policy textbook, it explains that the U.S. social welfare programs help vulnerable populations, including older adults, through housing, healthcare, and income support. The OBBBA's cuts threaten these programs, making it harder for social workers to assist those in need. The Byline Times highlights that these cuts could triple homelessness among people over 50 by 2030, showing the serious impact of social decisions on vulnerable groups. So some of the implications for social work is that we could go out there and advocate for vulnerable groups, challenge policies, promote solutions that address needs. We could also collaborate with advocacy organizations. Social workers can work with advocacy groups to get involved in legislative pushes for more funding and better programs to address poverty and homelessness. We can also provide direct services. Social workers can continue to provide support for people that are homeless or in poverty, including mental health services, behavioral health services, helping them access housing and healthcare, and how to manage difficulties when maybe their situation has been made worse. Another thing that we could do is educate the public and policy makers. Further implications for social work is that reducing public assistance through the OBBBA could make life harder for people who rely on programs like these. Low-income families, older adults, and individuals with disabilities may face higher risk of poverty and homelessness. Local services and nonprofit organizations might struggle to meet the increased demand, and social workers could see more people needing help with things like housing, healthcare, basic needs. Overall, these cuts could make it more difficult for communities to provide the support that people need to stay stable and plan for the future. Discussion questions are: how can policy decisions like the OBBBA influence the broader goals of social welfare and poverty reduction in the United States? And then my second question is, with policies like OBBBA, which limits available resources, how do your personal values and sense of ethics guide the way you, as a social worker, respond to individuals experiencing poverty and homelessness? My references were our American Social Welfare Policy book, our Social Work Speaks book, and a news article through Byline Times.